Hello, my name is Isis McMillan. I'll be the student nurse taking care of you today. The physician prescribed you a new medication called dronedarone. It is an antidysrhythmic, meaning that it is used to prevent arrhythmias, such as atrial fibrillation. Another name for it is Multac. Since you have a previous diagnosis of atrial fibrillation, this medication will help prevent you from being hospitalized again by maintaining a normal heartbeat. You will continue to take this medication after you leave the hospital, so it is important for you to know some things about this medication. It is very important that you do not miss any doses, but if it does happen, do not double dose. Continue to take this medication on your regular schedule, and do not drink any grapefruit juice. This can increase the risk of side effects because this medication will be increased in your blood. This can also happen if the medication is mixed with other types of medication, or some can do the opposite by decreasing the effects of dronedarone. So it is important to talk to your doctor before taking any new medications to avoid any harmful drug interactions. Finally, this medication can cause heart failure, so you should be weighing yourself frequently because a sudden weight gain can be a sign of heart failure. Also, look out for signs of difficulty breathing and edema. Edema is swelling. It typically happens in the legs and feet. Before I give this medication, an EKG will need to be done to ensure you do not have any abnormalities in your heart rhythm. A blood test will also be done to make sure your electrolytes are normal. This medication works by blocking potassium, so we need to make sure your potassium levels are not too low. I will also need to check your heart rate to make sure that that is not too low as well. After this medication is given, your heart will continue to be monitored with an EKG, and it will be important to look out for any side effects. These side effects can include diarrhea, nausea, and a slow heart rate. Signs of a slow heart rate can be fatigue or dizziness. Some more serious side effects include heart failure, which I explained earlier, and QT prolongation, meaning that your heart is taking a long time to contract and relax. A sign of this can be dizziness. Some people can also have an anaphylaxis reaction to this medication. These symptoms can include difficulty breathing, itching, and swelling. After I leave your room, I'm going to keep the call bell next to your bed. It is super important to notify me if you're experiencing any of those side effects. Since it is now 8 in the morning and I have completed your assessments and everything appears normal, and you have also just been given breakfast, I can now give you your medication. Dronedarone will be given to you by pill twice a day, once in the morning with breakfast, and once in the evening with supper. Each pill contains 400 milligrams, so you'll have a total of 800 milligrams throughout the day. It is important to not exceed this amount. Do you have any questions for me? No? Okay, here's your medications.